Hi, Dr. Gary Swift. Thank you for talking to me today. First of all, can you tell me a little bit about yourself?
Christy, I'm 48 years of age. I'm married with two great teenage kids, and I'm an obstetrician and gynaecologist in private practice on the Gold Coast. I've had the good fortune of having a healthy, happy family, and it drives me to make sure I help couples achieve the same sort of goals on that level.
And what kind of training have you had?
Christy, I grew up in Brisbane. I went to the University of Queensland for my primary medical degree, and I graduated from there in 1988. I then worked as an intern and a junior house officer at the Royal Brisbane Hospital before moving out west to spend 2 years working at Toowoomba. And during that time I got to spend a 6-month term in a diploma of obstetrics and gynaecology job, and then made a choice that was going to be my career path. So I moved back to Brisbane, started working at the Mater Mothers Hospital in Brisbane, and then moved to the Gold Coast and started my obstetrics and gynaecology training. So that training program is 6 years long, so I've spent a few years initially at Gold Coast, then to Brisbane, North Queensland, back to Gold Coast, and then I spent my last year in Melbourne at the Mercy Hospital for Women in a laparoscopic surgery fellowship position before moving back to the Gold Coast in early 2000.
Gary, how long have you been practicing and where?
So I've been a fully qualified specialist since December 1999, and I've had a private practice on the Gold Coast since January 2000. I've also had a public appointment at the Gold Coast Hospital from 2001 to 2003, and then more recently I've reinstated that appointment, and I work both at Robina and Gold Coast Public Hospitals and share some of the after hours load as well. My primary practice though is on site at Pindara Hospital in Benowa, and that practice sort of is on site and it's conveniently located with the maternity ward close by, the labour ward in easy walking distance, and we have the IVF unit situated next door and the day surgery unit in the same building as my rooms.
And Gary, what areas do you specialise in and why?
So my practice has three main components, and they each give me this sort of similar satisfaction. My reproductive medicine interest stemmed when I was one of the founding partners of the Queensland Fertility Group Gold Coast unit in 2001, and with 3 other directors we built the unit up from scratch. I completed a Masters in Reproductive Medicine through the University of New South Wales along the way, and now that sort of drives the major part of my practice in infertility and reproductive medicine. So helping couples sort of achieve their pregnancies with IVF is a very important thing to me. The other main focus I have on the gynaecology side is my laparoscopic surgery. My fellowship in the 1999 started my pathway of building an advanced laparoscopic surgery practice, and now I sort of have a particular interest and I have quite a large patient load of women with endometriosis and other conditions related to fertility. So laparoscopic surgery enables small incisions, short hospital stays. Patients are often in overnight. We can do a large number of operations with only very small incisions. Endometriosis is by far the biggest condition we treat, and in conjunction with sometimes urologists and colorectal surgeons, we treat even the most severe cases and have very good outcomes. And for a lot of those women, fertility is an issue, and either by surgery alone or combined with reproductive medicine and assisted reproductive technologies, we're able to help couples have babies. And of course, the core business of obstetrics is always there. A lot of the women I look after now have come through the IVF program, so they're complicated pregnancies. They require a lot more time and attention, and it takes that little bit more effort to help them get successful outcomes. There's a lot of women who come through without problems, who are what we call low risk and have easy pregnancies and deliveries, and then there's the other spectrum of women who have quite complicated problems and difficult scenarios. But the focus is always to get them through and have healthy babies and safe deliveries.
Absolutely. Can you give me a quick overview of your practice here at Pindara Place?
So, Christy, the practice is very central on the Gold Coast. I've got a panorama of Service Paradise out my window. It's very easy to access. We've got a large double suite. There's 2 doctors that work in the rooms here. We've got a very very competent reception staff and a very large recently refurbished suite with modern facilities. We're directly above the day surgery unit, so day surgery procedures, IVF, reproductive medicine procedures are in the same building. The IVF unit with the embryology laboratory is directly next door, and it's only a short, barely 100-metre walk to get to the maternity unit and the delivery suites. So we've got everything very closely located, and it works. We're a very coordinated practice that's easy to sort of deal with the day-to-day patient load that comes through.